Hi, I'm Dr. David. I'm at Magnolia Skin Center. We have an exciting conversation to have today about Plasmage, eyelid, and eye bag lift. My team has compiled some questions for me to answer. Let's go. So the first question is, can this really lift my heavy hooded eyelids without the cutting, stitches, and scars of eye surgery? The answer is absolutely. As a matter of fact, because we can tailor to your exact structure and we can treat very diffusely in a quite a significant area, shrink wrap all the skin and lift it all, it's going to look much more natural than trying to calculate what parts of the skin to cut out to get a natural look. So the answer is yes. Second question, will a plasma eyelid lift cause extreme swelling or make it hard to open my eyes the next morning? So the answer to that is possibly. Okay. What what I have found from doing what we have found from doing a very large number of these procedures is the amount of swelling is variable. Some people are more swellers, some people are less swellers. Okay. So we let you know that you could be a sweller, and in which case, you know, plan on that. You could have a couple of 3 days of significant swelling with some cool packing, and which is also why we make sure that you have a ride home and all of these things to make sure that everything goes well. But there are people who don't have any swelling at all. So that just kind of depends on you. We do ask you to, we will go over instructions with you to not consume a lot of salt and other things that can be done to minimize swelling after the procedure. Question number three, can this erase my stubborn under eye laugh lines and frown lines during the exact same eyelid lift? Yes. Okay. So when we are working with Plasmage, we can do the entire area all around the eyes. Okay. We can do eyelid lift. We can do lines and wrinkles. We can do crow's feet. We can tighten up the skin underneath, which is contributing to the weakness that's allowing you to see bags. We can get laugh lines and smile lines coming down onto the face. All of that can be done on the same sitting with the same numbing painless procedure. Knock it all out while you're there. Question number four, how many days of social downtime should I plan for before I look normal enough for work or events? So if you're working around the eyes, the good news is that sunglasses, Jackie O glasses, colored glasses can be very helpful. Again, it depends on how much you swell, for one thing, and it depends on the rate at which these little spots I make drop off, which can be anywhere from 4 to 6 days. So realistically, I would say count on a week of um, potentially looking where people can see little dots or some swelling that you might or might not want to show. Um, that would be a rough ballpark. So, is this non question number five? Is this non-surgical eye lift safe if I wear contact lenses or I've had LASIK eye procedure? Absolutely. We're not getting into the white part of your eye, the conjunctiva, the cornea, the inner lids, anything like that. This is an external eye procedure. So none of that would be affected. Totally fine if you've had LASIK. Totally fine if you wear contact lens. Question number six. How many treatments do I need to see a dramatic lift that keeps me from needing a surgical eyelid surgery? You're going to get a dramatic lift with treatment number one. Now, how many treatments you might need is going to depend on the degree of laxity, obviously. If you have very large hoods that are literally overhanging your eyelashes, okay, that's not going to be completely gone with the first treatment. We're going to get significant lift, and we're going to uh, do over time until we get to where you need to go. So it just depends on where we're starting. And then finally, the seventh question, what steps do you take during the procedure to make sure the plasma energy doesn't hurt my actual eyes? So we have a lot of ways that we're very careful about this. Of course, we have you keep your eyes closed. That's the number one thing. And we're very careful as we do these treatments. If we have somebody that we feel is a little bit more difficult for them to do that, we have special goggles designed that we can cover the areas where we're not working. And we even can, depending on the situation, if we want to work very close to the lash line and we have any fear of that, we have something called intraocular lens shields, okay, that we can put in that are completely comfortable, that completely protect any possibility of any exposure to the cornea, conjunctiva, or those areas. So we have plenty of ways to make sure that there's no compromise of safety with this procedure. At Magnolia Skin Center, can't wait to see you.